Uganda has continued to receive global plaudits for the way it has handled the COVID-19 pandemic since mid-2020, with the regime putting in place a number of stringent measures, including locking down schools for nearly 2 years. Recently, US aid praised Uganda for being a leader in the continent for COVID-19 vaccination. But underneath this eye-catching performance lies a number of accountability issues, including the billions of shillings that were budgeted for the procurement of vaccines in 2020 and 2021, as the government has relied more on vaccine donations. A large crowd of people has gathered at this remote outpost of Kanungu Health Center 4. Word had spread across the villages that it was the last day the facility was offering COVID-19 vaccination. Such queues for COVID-19 vaccines are a common sight across the country. Health workers blame the populations for waiting until the last day, while locals blame the methods employed by health workers.
A challenge for people coming very early in the morning at around 8 a.m. They spend the whole day without even taking something inside. As they come, they reach without taking breakfast even. So now they be vaccinated at around 3 p.m.
The turn up for this vaccination campaign is very positive. So many people are coming in to receive their first and second doses. And as Kanungu Health Center 4, we have also set up 10 satellite stations so that we reduce congestion at the facility. The turn up, so far we have already vaccinated 46% by yesterday evening, though the data misses 3 sub-counties. And in total we have so far covered 91% for those who received the first dose, and for the second dose we are at 46%.
Across the country, COVID-19 jabs are being offered in the Ministry of Health designated points. But the exercise is littered with challenges such as apathy, shortage of jabs and extortion. Some individuals who are not keen to be jabbed can acquire vaccination cards for a fee. At Kabule Health Center 3 in Mityana district, health workers only administer jabs when there are at least 10 people, which means that those who wake up at the crack of dawn have to bear the brunt of waiting. Farthest southeast in Rubirizi district at Gichamba Health Center 3 and Rugazi Health Center 4 in Nyaruguru County, we found a few people or hardly anyone in sight respectively.
Because we have most of the vaccines, those coming for the second dose, they can receive, and those who are taking the first dose, they can receive, because we have most of the types. The AstraZeneca, the Moderna, the Pfizer, and the Johnson & Johnson. Very much so. More campaigns are needed, more sensitization is needed, because not all people receive information at the same time.
We have enough vaccines in our fridge. They are there, but the turn-up is so little. People used to like Johnson & Johnson. I remember the previously that massive campaign we had. People were wanting Johnson & Johnson. When it came in shortly, the turn-up was so much in that it even exceeded the number of vaccines for Johnson & Johnson. It got finished. But now, good enough, now it has again come back. But now those people are not there. And they used to like Johnson & Johnson because it was a single shot.
It has been that, you know, in the first campaign, they could say that when you are vaccinated with the Moderna for the first dose, you wait until Moderna comes and you get a second dose. But now the government has changed the goalposts, that when you get Moderna, it is also heresy to get second dose, which is the Pfizer or any other vaccine. But people are still scared because they had consumed the first information that when you are vaccinated with such a kind of vaccine, then the second dose should be exactly the vaccine you got at the first place.
At Kaperibyong Health Center 4 in Teso, averagely 5 people are vaccinated in a week, while health workers have gone for spells without getting their allowance.
There are so many things that are in the social media. People are talking about this vaccine is like this, so it makes people to shy off a bit. But we've given people, we are in the communities trying to give people the information, the rightful information, and we are saying anything on vaccination, please get the information from the person whom you think has the rightful information. Yeah. As a district in total, I can say, as I had told you, some weeks you don't get, some weeks you can get maybe 3 people.
At a Park General Hospital in Langosa region, health workers arrived at hospital early in the morning to give jobs. At Mayuge Health Center 4 in eastern Uganda, residents accused health workers of extortion. Diana Atwine, the Ministry of Health Permanent Secretary, told NTV the vaccination exercise is going smoothly and admonished those who don't report corrupt practices.
I have heard that people are selling cards, but it is unfortunate. Do you know when or even to pay for their jobs? Those of you who are paying for such, you are committing a crime. You are committing a crime, and you should yourself, even you who gave money, you should know that you are part of the problem of this country. Don't talk about just corruption. Do something about it. Just report, expose the people who are doing that.
She said fighting corruption is a concerted effort.
And for me, really, I get so upset when I just hear people just talk just empty like that. If you have evidence of some sort, bring forth. Let that person be held accountable. Don't just talk, because talking we are not going to fight corruption by just talking. So if someone is selling a vaccination card and you yourself, you have gone ahead to pay for the card, you are part of the problem. You are the enemy of Uganda. You are part of the problem. But if you see someone paying and you expose, you go and you say, so and so, you paid. You paid the nurse, and the nurse gave you the card. Expose those people so that we go for them. For me, I would not spare anybody, sincerely. I would not, once I have evidence. Once I have evidence, I cannot spare any single person. But the issue is just people around the country. Now, where do I start now?
March 20th, 2022 marked 2 years since the coronavirus caused by the novel SARS-CoV-2 made a landfall in Uganda. The index case was registered at Entebbe Airport, and later several cases recorded at the Busia and Malaba border points as the virus barreled deep inside the country. The government responded swiftly with stringent measures, including closing of all border points and back-to-back lockdowns in 2020 and in 2021 during the second wave of the pandemic. Vaccines, touted as the most critical tool against the virus, became available in late 2020, starting in first world countries. Uganda received the first donations batch of 864,000 doses of AstraZeneca vaccines through the COVAX facility, the world's facility for universal access to COVID-19 vaccines, on March 5, 2021. 2 days later, on March 7, 2021, the Indian government donated another batch of 100,000 AstraZeneca vaccines, bringing the available stock to 964,000 through donations. It is against this backdrop that the country launched the first phase of COVID-19 vaccination campaign on March 9th. In an earlier address on February 11, Health Minister Jane Ruth Acheng indicated that government, through the Health Ministry and the National Medical Stores, the statutory body mandated to procure, store and distribute medicines, had placed an order of 18 million AstraZeneca doses from the Serum Institute of India. Of these, she said, 400,000 were expected in the country by mid-March that year, and the rest would be delivered later in the year. Dr. Cheng said government would procure each dose of AstraZeneca at $7. This was, however, double of what the European Union was paying $2.16 per dose and triple of $5.25 that South Africa was paying for a dose. The cost of $7 per dose elicited suspicion and outcry from civil society actors. But later that afternoon of February 11th, Parliament approved a supplementary of 18.6 billion shillings under the Ministry of Health's vote 014 for procurement of vaccines. The money, the 18.6 billion shillings, was transferred to NMS later on March 29, 2021 to place the vaccine orders. It was also the last time the country heard about the money.
First, government provided money. Last year in 2021, in March, the very first batch was 18 billion. And then in June, they provided another 30 billion. But up to end of June, we had provided 42 billion and we hadn't procured a single vaccine as government of Uganda with that money. What we had was donations. So the same report for the Auditor General says that by end of October 2021, we had procured 1 million doses only of the vaccine, and we had received 15 million doses as donations. That is by end of October. But by March last year, when we were planning to procure, we had looked at getting about 18 million doses. But remember, by October, we have only 1 million doses.
Remember that also as a country, we suffer from a chronic problem of diversion of resources. The law actually says that Parliament appropriates resources for specific activities within government. Unfortunately, government reports have indicated that as a country, we have a very bad accountability practice of diverting resources without going back to Parliament to ask for reallocation of those resources. So while we could be thinking that the money was not spent or was already paid up front, they could have been diverted to cater for other expenses, which is actually not the right thing to do, but it is a common practice in this country.
As of March 29th, last week, according to the Health Ministry, Uganda had received 21.9 million vaccines. Of the 21.9 million jabs, the US government donated 12 million doses as of February 2022 as part of the Washington's vaccine diplomacy. The balance of 9.1 million doses have also largely been donations. On June 16, 2021, the country received another batch of 175,200 AstraZeneca vaccines. On July 31st, Norway donated 286,080 vaccines and China 300,000 doses of Sinovac, among others. Other countries that have donated vaccines to Uganda include Spain, Denmark, France, Belgium, Germany, and Canada. The government gets the vaccines through 3 channels: donations, the major source so far, the COVAX facility, which was co-founded by World Health Organizations, the French government, and EU, and is led by the Global Alliance for Vaccines and Immunization, and thirdly, through the African Union's African Vaccine Acquisition Trust that acts as a centralized purchasing agent on behalf of the African Union. Besides donations, the government equally doesn't pay a penny to the COVAX facility. One official told NTV that while government had ordered for more doses through the African Union, it had also received more donations, which have covered the gap. Several policy documents between 2020 and 2021 contain a budgetary allocation of billions of shillings for procurement of vaccines, but nowhere is it indicated that these vaccines arrived yet.
The money we received, all the money that we received, was a small fraction of the money required to buy the vaccines. It was a very small fraction, which we deposited to African Union and COVAX. Of that, even they have supplied us more than what we have paid for. We are still waiting for more money to come. Ministry of Finance is working on that, working with the World Bank to get some money. Once we do that, once we get that money, we shall calculate the deficit, because we cannot now, we may have to discount because we got some donation.
In her written responses last August to the report of findings by the Parliamentary Ad Hoc Committee on the country's national COVID-19 response, Dr. Cheng detailed plans to acquire 18 million doses of China's Sinopharm vaccines through the COVAX facility and 9 million Johnson & Johnson vaccines procured through the African Union. The Sinopharm and Johnson & Johnson vaccines were expected in the country by October and September 2021, respectively. In one of his routine addresses on COVID-19 on September 22, 2021, President Museveni detailed the batches of 1.2 million Johnson & Johnson and 2 million Sinopharm vaccines procured by his government arriving by end October and September, respectively. But 6 months later, the two consignments are not captured anywhere on the Ministry of Health's update vaccine chart, meaning they were either not procured or are yet to arrive. Christine Birinjiro, the program manager at Uganda Debt Network, an anti-corruption NGO, said vaccine procurement has been quite opaque.
It speaks a lot to the lack of or limited transparency and accountability by government, of course, because most of these things, the information is not given. It is not made public, and so that is why some of these things, when they come out, because some people go, behind doors to get this information, there's no transparency and accountability. But why? Because I think there's a lot of corruption.
In May 2021, when India was battling a resurgence in the COVID-19 caseload, the Serum Institute noted that it would not supply vaccines until at least December 2021 to help the Indian government tackle the deadly second wave. The Auditor General, John Mwanga, in his latest report submitted to Parliament early this year, detailed that while money had been transferred to NMS, no vaccine had been delivered by the end of the audit year. NMS's spokesperson, Shiran Huchire, declined to respond to our inquiries. But while appearing before Parliamentary Committee on the COVID-19 response in July, both the NMS Director General, Moses Kamabare, and Finance Minister could not account for the 18 billion shillings.
So, my advice, Mukuru Kamabare, you should discuss this with your permanent secretary. Those items that you are supposed to be handling, you should be the one to prepare a budget for, and we release the money straight.
We should be very clear on this. We cannot afford to have, is it finance, is it health, is it national medical stores? And who should guide who? Or who should sort out who? Honorable Minister, we are in a crisis. We now need to know who is supposed to procure vaccine for this country. Is it national medical stores? Or is it Minister of Health? Or even finance?
Mr. Chairman, for us in finance, our job is to give the money to whoever asks for it.
So really, because the country now, we take for example, the most, I don't know how I can even put it, but really the priority now is vaccine. Who is supposed to procure this vaccine? Honorable Minister of Finance. Whom are you going to give money to procure the vaccine?
Let me repeat myself.
We last time we appropriated money for vaccine, didn't we?
Yes.
You gave that money to who?
I think we must. I can't know. I don't remember the real details. But if the request came under Ministry of Health, the money will go to Ministry of Health.
Mr. Kamabare further told the Select Committee that in this financial year 2021-2022, 560 billion shillings was allocated for vaccine procurement but had only received 80 billion shillings, with the rest of the money still held by the Ministry of Health. The Health Parliamentary Committee early this year also tasked NMS for a proper accountability and audit for billions of shillings allocated during the last two 2022-2021 to 2021-2022 for procurement of vaccines. In this financial year 2021-2022, at least 80 billion shillings was allocated.
In addition, I undertook 4 thematic audits covering management of COVID-19 pandemic intervention.
The Auditor General's report also details that there was barely any progress towards securing vaccines and treatment for COVID-19, and yet billions of shillings were doled out to research projects under the Ministry of Science and Technology. Peter Echeru, the Program Specialist for Health and Human Rights Advocacy at the NGO Center for Health, Human Rights and Development, says the accountability for vaccine funds remains questionable.
What is very clear is that across there have been challenges in terms of accounting for the resources that were received for COVID. One of the reports, including the one from the Auditor General, the parliamentary report, the Budget Monitoring Unit report on COVID, all this clearly show that we have a challenge when it comes to management of COVID resources. But this is not surprising, because every time in this country we've had an emergency, we usually have a challenge in terms of how do we account for this money that comes through. Whether it is floods, whether it is refugees, I think it is that point when we fail as a country to hold those who use the resources accountable.
He said proper accountability has remained a challenge for the most part.
You see, you cannot make the only argument that you see we did well. And also that argument of saying that we did well is not conclusive. The circumstances under which we live as a country are totally different from those other countries where they got so hit so badly. But beyond just saying that we did well, we must reach a point where we say that we get value for money. That yes, we did well, but at what cost did we do well? So it is important for us to balance between the deliverables that we've achieved against the amount of money that we have put in there.
On February 17, 2022, the Ministries of Finance and Health inked a financing agreement with the World Bank for the provision of $180.3 million, that is about 641 billion shillings, for procurement of COVID-19 vaccines. Uganda's COVID-19 response received global plaudits in the early days when the country, whose workforce has immense experience in dealing with outbreaks such as Ebola, cholera, Marburg and Crimean Congo fever, registered a few cases over a period of several months during and after the lockdown. However, the opaque award of contracts and dubious accountability is eliciting questions that require the piercing of the veil by conducting a forensic audit.